Welcome back to Ask Me Anything. This is the episode where we answer questions from our subscribers and members. If you're interested in becoming a member so your questions can be answered, make sure to check us out at supercast.arinamalik.com. As a member, you can submit your own questions, get early access to podcast episodes, and receive full transcripts. Without further ado, let's get to it. The first question comes from someone who says, I am not originally from the US. I've never gone to any doctor to have my vagina or private parts examined. When I moved to the US after marrying my husband, I had sex for the first time and realized it was a very painful experience. I thought the pain would go away with continued sex, but it hasn't. My neighbor was shocked when I told her I'd never seen a doctor for my private parts. In my home country, they don't do breast exams, pap smears, or similar checkups. So I'm unsure if that's why sex is painful for me. Any thoughts? This is an excellent and important question. There are indeed countries where pelvic exams are not commonly performed or where access to gynecological care is limited. First and foremost, sex should never be painful. If you are experiencing pain during sex, there is an underlying issue that needs to be evaluated. It won't simply go away with time or by having a glass of wine. The first step is to identify the cause. You should see a gynecologist and possibly a urologist for a full evaluation, including a pap smear and general pelvic exam. This helps rule out conditions like cervical cancer, infections, or other medical issues, and provides a baseline for your reproductive health. There are several common causes of painful sex. First, make sure you are fully aroused before penetration. For women, full arousal can take up to 25 minutes. During arousal, the vagina lengthens and widens, roughly doubling in size, to comfortably accommodate penetration. Without proper arousal, penetration can stretch tissues that are not ready, causing pain, especially if the cervix hasn't moved upward and out of the way. It's helpful to identify whether your pain occurs with initial penetration or deeper penetration, as this can help your doctor determine the cause. Another important factor is lubrication. Many people assume they don't need lubricant, but using it can make sex more comfortable and enjoyable. It reduces friction, increases pleasure, and is completely safe. Additionally, pelvic floor dysfunction is a common but often overlooked cause. Some people have a condition called high-tone pelvic floor dysfunction, where the pelvic muscles do not relax properly and remain tight, which can cause significant pain during sex. Another related condition is vaginismus, where the vaginal opening involuntarily tightens, making penetration painful or impossible. Pain can also result from vestibulodynia, which affects the sensitive area just outside the vaginal opening, known as the vestibule. Hormonal imbalances can make this area painful, but it can often be treated with hormone creams or other medical options. Another potential cause is pudendal neuralgia, which is inflammation or irritation of the pudendal nerve that supplies sensation to the genitals. This, too, can cause pain with intercourse. There are several general tips that can help anyone experiencing painful sex. Use plenty of lubricant, allow enough time for foreplay and full arousal, and work on managing stress, as anxiety can make the problem worse. Interestingly, studies have shown that women who practiced mindfulness meditation for 20 minutes a day over 8 to 12 weeks experienced greater desire, arousal, and improved orgasms. Many continued meditating even after the study ended because the results were so positive. Stress and pain often create a vicious cycle. Anticipating pain makes you anxious, which increases pain and tension. Breaking that cycle through relaxation and professional help can make a tremendous difference. So, if you're struggling with painful sex, please seek medical care. There are many effective treatments available. The next question says, I'm having pain in my testicles. I did the No Nut November challenge and decided to avoid masturbation until I met a girl and had sex the regular way. But I've had no luck with women since starting this challenge, and now I'm feeling a dull pain in my balls. It's not sharp or severe, but I notice it throughout the day, especially when I'm turned on. Are my balls too full? There are two likely explanations for this. The first is something commonly referred to as blue balls, or medically epididymal hypertension. When you are aroused, blood flows into the genitals, including the testicles. Normally, ejaculation releases that pressure, allowing blood to flow out normally. If you are aroused but do not ejaculate, that blood and pressure remain trapped for a while, which can cause discomfort or aching. It's not dangerous, but it can definitely be painful. Some men even go to the emergency room thinking something serious is wrong, only to learn it's just blue balls. The second possible cause is pelvic floor dysfunction. Prolonged semen retention or avoiding ejaculation can lead to constant clenching of the pelvic muscles, which over time become tight and overactive, a condition known as high-tone pelvic floor dysfunction. This can cause testicular pain, pain with ejaculation or erections, constipation, or urinary urgency. Think of it like holding your arm in a bicep curl all day. Eventually, the muscle becomes sore and stiff. The same thing can happen in your pelvic floor. If your discomfort doesn't go away after ejaculation or rest, you should see a urologist for an evaluation and possible pelvic floor therapy. The final question comes from a 69-year-old man who says, "My PSA went from 1.2 to 3.2 about 10 weeks ago. My urologist stopped my testosterone cypionate injections, 200 ml, 1 meal every 10 days. What would you do in a similar situation? Elevated PSA while on testosterone? Should I be concerned?" This is a very good and common question. Testosterone therapy, also known as exogenous testosterone, is prescribed for people with low testosterone levels, a condition called hypogonadism, who experience symptoms like fatigue, erectile dysfunction, low libido, mood changes, or difficulty gaining muscle. For many people, testosterone replacement can be life-changing. Historically, doctors believed that testosterone increased the risk of prostate cancer, since early prostate cancer treatments involved removing or blocking testosterone. However, modern research, including the recent Trevor study, has shown that testosterone therapy does not cause prostate cancer. Here's why. The prostate has a limited number of receptors for testosterone and DHT, the active form of testosterone. Once those receptors are filled, adding more testosterone doesn't further stimulate the prostate. In fact, low testosterone is actually associated with a higher risk of developing prostate cancer. Your urologist stopped your therapy temporarily to rule out prostate cancer, which is a cautious and appropriate decision. If your evaluation comes back normal, it is generally safe to resume testosterone under your doctor's supervision. Some men even restart testosterone therapy after prostate cancer treatment, once they've been in remission for a certain period of time. Of course, every case is unique, so always defer to your own urologist, who knows your medical history, lab results, and imaging best. It's also important to look at PSA trends over time, not just one reading, since PSA levels can fluctuate for various reasons. Thank you for joining us for today's episode of Ask Me Anything AMA. If you'd like to hear the rest of this episode and gain access to more in-depth discussions, sign up for our premium membership at rainamalik.supercast.com. As a member, you'll be able to ask me anything, get early access to podcast episodes, download episode transcripts, and support the educational work we do here. We truly appreciate your support, and as always, take care of yourself, because you're worth it.